How long are you waiting for a family doctor?
2 years, almost 2 years.
One hand, that's all it takes to count the amount of clinics available to residents here at Parc-Extension, one of Montreal's poorest and racially diverse neighborhoods. Parc-Ex has one of the lowest registration rates for family doctors at 61%, according to Health and Social Services Ministry. This means that people in the community must go to emergency rooms or try to find a walk-in clinic that can serve them. And while this sounds easy enough, most families here are newly arrived to Canada.
This makes it even more challenging for those individuals to access primary care. There are the language barriers. There's also the very low internet literacy, medical literacy.
You can imagine the frustration and the negligence they are going through because they are not getting any medical help, and they are going through depression. They are going through anxiety.
Waiting, you have to wait. People are waiting 7 years, 10 years, so you have to wait. So I face many problems. When I became sick, I can't manage any doctor, and it's big problem.
Montreal's Côte des Neiges and Parc-Extension are neighborhoods that are densely populated, but the government of Quebec groups them together when it comes to how many permits they give out for doctors to practice in the areas. Parc-Extension rarely sees an increase of permits, while the majority is given to Côte des Neiges, leaving Parc-Ex a medical desert.
So there's very few clinics in the Parc-Extension neighborhood, whereas in Côte des Neiges, there are numerous clinics. Some of them are GMF Réseau. Some of them are group practices or private clinics, and then you have the teaching hospitals and the CLSC.
Emergency also, there is a problem. They don't listen. They said you have to go to see your family doctor. So this is your minor problem. You don't have to come in the CLSC.
So for us, being community workers, providing them services for the integration programs and giving them support, as well as trying to help them holistically, sometimes it's very overwhelming.
Ghazala, coordinator of the South Asian Women's Community Center, says while the lack of doctors available is an issue that has increased over the pandemic, the bigger issue is the lack of access of services due to language and socioeconomic barriers that need to be changed.
They need system within the systems to make it easier for the new immigrants or for the immigrants who are living here, so they can access all the services that are supposed to be for the citizens of this province.
In Montreal, Felisha Adam, City News.